Assalamu alaikum wa rahmatullahi wa barakatuh. Our esteemed viewer, once again, it's your program Health Check, a program where we give you medical advice from medical experts, but still advise you before you take our advice. You need to consult your own medical personnel to see whether the advice that is given to you matches with your health. You know, you have different healths, and we need to tackle them in a different way. So this is Health Check again, and your host is Nambale Bashir. I still have been defining health as a state of being free from any sorts of ailments, be it mental or physical. And today we are tackling again eye problem or sight problem. And the topic of discussion today is Ophthalmia Neonatorum. That is the topic of discussion today. And guest we have today is Dr. Herbert, again, who traveled again, once again. He had our call and responded to it positively, traveled 230 kilometers to have and share his advice with you. Dr. Herbert, you're most welcome.
Thank you so much, my brother. I'm glad to always be here.
We are glad to see you again. Thank you. For coming and giving us a hand. We shall have you, our viewers, since this program is meant for you. We shall have you and see the views that you have regarding the topic of discussion today. You have any questions? I have doctors. Ophthalmia Neonatorum is the topic of discussion, but if you asked me what it is, to be honest, I don't have the answer, but we are lucky enough to have a doctor in the studio.
Oh, yes.
Define the term Ophthalmia Neonatorum for our viewer.
Okay, thank you so much. Ophthalmia Neonatorum, those are two different words. The first word is ophthalmia and the other one is neonatorum.
Yes. Which
originate from two different things. Ophthalmia, which means pertaining of the eye, and then neonatorum, which means a neonate.
Okay.
Yeah, a neonate is a newborn who is less than 28 days after birth. Yes, 28 days. And then ophthalmia meaning pertaining the eye.
Okay.
Yeah, so it is an infection of the eye in the first 28 days after birth.
Infection of the eye in the first 28 days
after birth.
Okay.
Yes.
Thank you so much, Dr. Herbert. How do people get into contact with Ophthalmia Neonatorum?
Yes, like we said from the beginning, it is an infection of the eyes in the first 28 days after birth.
Okay.
Yes. So the common ways how a child or a baby might become infected with this disease is through the birth canal of the mother.
Okay.
When the mother has an infection during pregnancy, and then at that time of birth, when the baby is coming out, because where the baby is in the placenta, the disease cannot cross and enter the placenta. But this time during birth, as the baby comes out, the baby is exposed to the infection. And because they come out with their eyes, the skin around the face is exposed to the infection, the germs can easily come in contact with the eyes. Yeah, so any discharge that you see, especially the first 28 days, it might be tearing or maybe a pus discharge coming from the eyes, even in the first week after birth.
Yes, yes.
Immediately suspect this condition, Ophthalmia Neonatorum. Yeah, because babies don't produce tears until 3 months.
Oh.
So when you find the baby tearing, then it's not.
Repeat that. Yes. Babies don't produce tears until they are 3 months.
Until they are 3 months old.
I didn't know that.
So if you see some tears coming out from the baby's eyes, just a week old, 2 weeks, suspect this infection.
Okay.
Yes.
So you need to hasten and see the doctors. Thank you so much, doctor. You've told us one of the causes, and we need to know the risk factors.
Yes. Now,
together with some more causes in case you have any.
Yes. Like we said, it is an infection that comes from that after the baby is exposed to the mother's birth canal. And what infection is in this birth canal? These are STIs, sexually transmitted infections.
Yes.
It can be all sorts of infections. It can be bacterial, viral, and different kinds of bacteria actually. Okay. But the ones that are really of concern to us most times is the gonorrhea and the chlamydia. those two species of organisms, of bacteria, can cause serious eye problems, yeah, if not tackled early. So the mother might have this infection during birth, and they spread it to the baby. So these two organisms, there are very many other organisms that can cause, but these two in particular are always our concern because they cause very bad complications. Gonorrhea and chlamydia, those ones can cause very, very, very bad complications to the eyes, to the baby's eyes. So we always need to tackle that one fastly and very aggressively. Yes.
Thank you so much, Doctor. Just like any other disease, and from your explanation, since it comes at a very early stage of birth,
yes,
then it must be very complicated. We need to know the complications that comes with it.
Now, after the baby is exposed to this infection, first of all, you'll see that the lids might start swelling after birth. You'll see a discharge coming out. It might be tears, or it might be a pus discharge coming from the eyes. The eyes are red, the lids are swollen, the baby has a fever. Those are all very bad, some of the symptoms that you will see on the baby's eyes. When you see that, run to the hospital very, very, very fast. Because these organisms, I remember during the COVID-19 saga, our dear president used to come and address the nation pertaining the health issues that were happening in the country, and was saying that this coronavirus penetrates the soft tissues, the soft parts of the body, like the eyes, the nose, the mouth, you know. So the eyes actually have very soft tissues. So these two organisms, the gonorrhea and the chlamydia, can penetrate the tissues of the eyes very fast. Yeah, and when they do that, they will form pus inside the eye. And once the eye has pus inside, we have to get rid of that eye. So you just imagine how traumatic, how traumatizing it is to remove a baby's eye. It is very bad. So some of the complications that will come is blindness. It can cause ulcers or wounds on the cornea, that glass of the eye. Yes. It can cause wounds of the cornea, and when those wounds heal, they leave scars on top. And those scars which are on top, the baby cannot see through, or any other person cannot see through the scar.
Scars,
yeah, so that eye will be blind. And most times it affects both eyes. It is rare that it will affect one eye. The condition will affect both eyes. So you can see that a person can become blind in their early childhood because of this condition of Ophthalmia Neonatorum. That is why some of the things, the countermeasures that we have employed to counter this disease are working. They're helping a lot. For example, the antenatal care. Yes, it is very important for mothers to go for antenatal care.
Seriously.
Yes, because when you go for antenatal care, they will check, and if they find that you have this infection, they treat you early before you give birth and expose the baby to the infection. Yeah, so antenatal care is very good, and other treatments as we shall discuss as we go on.
Thank you so much, Doctor. And our viewer, this is the time that you're coming in as well. You have part, you play a part in this program because it is meant for you. So this is your segment now. This is the time that we need to know whether you have been following precisely, whether you have any questions or advice. We are to you. We have a correspondent down the streets of Kampala. Let's see who he has today for us.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abaho Yasin Tuinamasko, and my question is, ophthalmia is thought by most people to be madness. So I would like to know, what does the doctor in the studio say about that?
All right, Doctor.
Yes, sir.
The viewers are following, trust me.
Yeah, surely.
The question that is coming from him is that they thought, this ailment is thought to be madness by most of the people. What is your view regarding this?
Well, it is not madness at all. It's not a mental issue at all. Like we have discussed even earlier, we have said that it's an infection that can occur during birth and to a baby. And this infection, after it has infected the eyes of the baby, can lead even to blindness. Permanent blindness, or even loss of the eye. So it's not madness, it is a condition that is happening in our communities, which which we need to sensitize people. Like our brother that has asked the question, we need now go back and teach and say this is not madness at all. This
yes.
condition is an infection and can spread to our children. We might lose sight. In our communities, it is not good. When a person is blind, even their lifespan is reduced.
Yes.
You know, even their productivity is reduced because a blind person might not dig,
Yes.
might not go and work, might not go and drive a car and look for a job.
And no one is going to give them work.
You know, though we are trying, because when they go to school and they're educated, they can do a lot of work.
They can be entrepreneurs,
Yes. You see, but
employing them is
their
another
productivity
problem.
is reduced. So those are very big challenges. So it's not madness. We need to sensitize the masses, and this is a very good initiative that we are here on TV to teach.
Yes.
But we should not stop here only. We should go outside there also, in the communities, village meetings, and educate people. Teach them such that they know when you see a discharge on your baby's eye, act immediately. Some people, you know, when you're a doctor, you see all sorts of things. Some mothers get breast milk and they put in the baby's eye thinking that they will clear the infection. Others get saliva and put. Others again get urine, which is also infected.
Another problem.
Another problem.
Might be the cause of the disease.
Yes. Get urine and again add to the baby's eye, adding salt to the wound. So some of those things we need to just educate them. Go outside there and teach them such that they don't use these things.
Okay.
And when they see such, they know what to do.
Okay.
Exactly.
These people went to school for you. Not everyone can be a doctor. Please don't be your own doctor or medical personnel. Please, in case you identify any signs onto your baby in as far as what the doctor has told us is concerned, please hasten and go to the hospital and seek medical advice. Don't be a doctor of your own self, otherwise you're going to cause more harm than good. Doctor?
Yes, sir.
It is very unfortunate that this ailment comes at a very early stage.
Very early stage indeed.
At an infant stage.
Very innocent child.
Very innocent child, has done nothing, has no part to play in as far as contracting the STDs is concerned.
Yes.
But guess what? They have contracted the virus.
Yes.
How do the parents and the babies as well cope with such a disease in case they have contracted it?
Thank you very much. That's a very good question. After you realize that the baby has this condition.
Yes. Do I throw the baby away?
Yes. Do I give up? Do I look for traditional eye medicines? No. Once you see any discharge, like I explained earlier, any discharge that is coming out of the baby's eyes in the first 28 days, think of this condition and run to the hospital first. Remember, we said tears come after 3 months. So we don't expect any tearing.
Yes.
Until the baby is 3 months. So when you see tears coming, you see the eyes red, the lids are swelling, the baby has a fever, run to the hospital very fast, and this condition should be managed. And we don't only manage the child. If the child comes and has a condition, we ask the mother, how do you feel? How you're urinating? Is it okay? Do you feel pain? Because we need to treat the mother as well. Not only the mother, but also the husband, the father, both parents.
That's why they are both advised to go for antenatal.
Yes, exactly. Because actually in the first antenatal visit, a father must be there. They are checked also.
Yes.
They check the mother and they check the father as well.
Yes.
For some of the conditions that can cause very bad complications. Yes, so like HIV, syphilis, gonorrhea, those other things. Yes. They check them. So parents, go with your wife for antenatal. Don't leave your wife to go alone. And when your child has this condition, you must know that we shall treat you both. We might ask the mother to go and bring the husband. Yes. We confirm that they both have the condition, we treat them both. Why do we want to treat them both? Because if we treat the baby only, and the mother and the father still have the infection, one way or the other, as they carry the baby, because the eye has soft tissues, this organism might come back and also penetrate. Because you might go to the toilet, you urinate, and forget to wash the hands.
Yes, exactly.
You come back with the infection, carry the baby, and spread it again to the baby. So, and you yourself, it can also cause you other complications. So we want to treat both parents and also treat the child
Okay.
to eradicate the condition.
Okay.
Yeah, so the treatment, very good immediately after birth, because we used to register very many children having the condition. Immediately after birth now, they apply a drug on the baby's eye called tetracycline. Very common one.
Yeah, now talking about the treatment, of course.
Yes. Tetracycline. We apply on the baby's eye such that we prevent any infection to progress or to increase. We put that medicine to control the infection immediately after birth. Sometimes when we see that the mother was the baby was at a risk of getting the disease, maybe in a prolonged labor, and maybe there was aided delivery, we even give drugs for the mother to go with to continue applying in the baby's eyes.
Yes.
Yeah. So firstly, that is the first measure that is on our part.
Yes.
We put that so that we prevent the infection. Then also you, the mother, identifying is very important. When you identify that there's any discharge coming from the baby's eye and you respond early, you'll have also helped us.
Yes.
When you come early, the better, before complications set in. Like we said, it can cause wounds on the cornea. And when the wounds heal, they will leave scars.
Yes.
And the child will not be able to see through the scars.
The child is healed but can't see again.
Can't see again. Very bad. Or the child might lose the eye. If pus goes into the whole eye,
Imagine
that eye might need to be
a
removed.
3 days baby or a 1 week baby
And
losing their eyes at that stage.
Grows up with one or no eye. It's not very good. It's not very good. So early treatment is very important. The treatment is there, and it is cheap treatment. Cheap treatment.
Okay. Thank you so much, Doctor. It's unfortunate that we have to call off the program. Do you have any concluding remarks before we sign out?
Thank you very much. Like I always say, and I'll say again, our health-seeking behaviors are lacking, especially in this African continent.
Yes.
And in men more than women. In a clinic day, I might see 40 women and 10 men.
10 is a very huge number.
Yes.
That is, to be honest.
Yes.
It must be less.
Yeah. So it is a bad thing. Why aren't men coming for health services? We need to talk to the men. Tell them you also need to come. A man can live with a headache for a month, and he's not minding. Wakes up in the morning, goes to the garage and works. I'm
among such people. Whenever I have to go to the hospital, I have to have someone carrying me. I can't obey whether I'm having malaria or headache.
You have to wait for you to be bedridden before you can send me now go to the hospital, which is not a good thing. Sometimes when the complications set in, they're irreversible. So we need to come early. When you have a headache, 1 day, 2 days, come. Let us check. There are very many reasons why a person might have a headache.
Yes.
Yeah, so come, let the doctors do their job.
And like I said before, we have some small medicines or tablets that we know.
People have Panadols in their pockets.
Yeah, I know that when I take these painkillers, headache will perish in just a few minutes. So when it persists, I keep on taking tablets.
Yeah. Treating only the symptom but not eradicating the cause.
Yes.
The cause is still there progressing, but you're treating the symptoms. Let me take Panadol, which is not a good thing. When complications set in, sometimes they're irreversible. And the worst complication is death. So
exactly.
We don't want to lose you men. You have families, you have children to take care of, and the nation needs you. We all need you. So seek health services early, always. Always. That is a golden rule for every one of us.
Thank you so much, Doctor.
Thank you.
What a humble and sweet advice that you've come with today. Unfortunately, it has to come to an end at this very time because I failed to maintain the relationship, a good one, of course, with time. You'll give me your advice on how to do it, but I'm trying my best. Still, time says, no, you don't have to go beyond 30 minutes. And that's what we had for you today. And until we meet in the next programs, inshallah, I remain your host, Nambale Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.